I think are curious about how in the world telehealth physical therapy would help them when they have something like leaking, and something that, for sure going to a physical therapy, women's health physical therapists, they can understand how that would help, but they're a little confused about what in the world I would do with them on telehealth. So the way it works is that once you have an appointment, I send you a link and you check into my waiting room and we meet at our appointment time. And I'll see you for a whole hour, and we'll talk about what's going on, your symptoms, and through hearing your story and hearing all the things that are going on with you, I usually have a pretty good idea about what's going on with your pelvic floor. But then I'll look at the way that you're moving. I look at the body head to toe, and really see the interconnectedness. So when people are leaking, it's usually either their pelvic floor is weak and needs to get stronger, or here's my pelvic floor here, or the pelvic floor is tight and holding a lot of tension. And in that case, Kegels aren't the right answer for a woman. In that case, they need to work on lengthening the muscles and relaxing the muscles and having better coordination of the muscles. So through the physical exam, I'll look at the way your whole body moves. I'll look at how you're breathing. I'll look at how tension in the first rib and the neck. I'll have you palpate yourself and your diaphragm and your abdominal wall. I'll have you check yourself I'll guide you through words about how to check for a diastasis in your tummy, where the six-pack muscles widen. That happens in pregnancy 66 to 100% of the time, and sometimes it just needs a little extra help to come back together post-baby. So I'll guide you through all of that, and then I'll guide you through a pelvic floor muscle contraction. And that's a lot of cueing and using different types of words and different types of imagery to see what clicks for you and what helps you. And also it's a lot of, tell me what you feel. Tell me how quickly your muscles contract. Tell me how quickly they let go. So it's a lot of using your own mindfulness and your own ability to feel your own muscles. And that's kind of a nice advantage of telehealth that I've experienced working with patients, is in the clinic, I know what I see and I know what I feel, but when I don't have that, there's another advantage, which is you get to really learn how the sensations in your body feel. And so it's a lot of communication. And so with that, I'm able to kind of figure out, okay, what's going on in the body to contribute to your leaking? Are you having tension here? Is your diaphragm not moving? Do you have a diastasis that we need to work on? Is your pelvic floor weak, or is your pelvic floor tight? What's going on in the hips? Sometimes I'll have test ladies sting them on leg, and I'll notice a hip drop. And okay, then I know we need to work on hip strength. And so that is a little bit about how a telehealth physical therapy visit works. I use whatever tools you have at home. So if you have tape, sometimes I'll guide you how to put tape on. It's very helpful for diastasis, for example. Or if you need to loosen certain muscle groups, I'll have you use whatever you have at home, which is great because it's well, what do you have? Show me all the balls you have and we'll kind of figure it out. And then we'll use whatever exercise equipment you have. I can mail bands, but a lot of times we're able to use whatever patients have at home. And so for telehealth, I see you for an hour for the eval, and then for incontinence, I would say I probably average about 4 visits total. And those visits, those follow-up visits, are just a little shorter at 45 minutes. And the nice thing about this type of physical therapy is just a lot of you learning what your body needs to heal, and me kind of guiding you, and people get really great results.